Hello, everyone. Thank you so much for joining us today for our Caregiver Chat series. My name is Dr. Lakelyn Hogan. I am a gerontologist and caregiver advocate for Home Instead. And these caregiver chats are sponsored by Home Instead. We do these on a monthly basis. I cover a variety of caregiving topics. So we thank Home Instead for making this possible. If you want to learn more about Home Instead, you can visit homeinstead.com. We also have a great Facebook group. That we invite you to join. And that way you can keep up to date on when these caregiver chats occur. Again, they do happen monthly. And so we invite you back month over month to learn about new topics related to caregiving. And one of the great things about these chats is that we take questions live. So we would love to hear from you. If you have questions at any point, please chat them in on the chat function on Zoom at the bottom of your screen. Or if you're joining us on Facebook, we invite you to comment below and we will get to as many questions as we possibly can. Again, my name is Dr. Lakelyn Hogan. I'm a gerontologist and caregiver advocate at Home Instead. And I'm joined by Brooks Kenny. I'll formally introduce her in just a bit, but hi, Brooks, how are you today?
Hi, I'm doing well. Thanks so much for having me.
Oh, we're so glad to have you here. And we're talking about brain health today. And I'm sure most of you at some point in time have had experiences where you've misplaced your keys, maybe forgotten a neighbor's name, maybe you walked into the kitchen, then you got there and you realized, what the heck did I come in here for? And it can be really hard to know, okay, is that normal to have those little lapses in memory, or is it something I should be concerned about? And so today we're going to be talking about those worries around brain health, and it might be that you're worried about yourself or a loved one's cognition, but learning about brain health is really important. And our brain health is just as important as the health of the rest of our bodies because it is the command center for our entire bodily function. So keeping our brains healthy keeps our bodies functioning. And I'm really excited to talk more about this today with Brooks. Again, the importance of brain health. Brooks Kenny is the general manager of BrainGuide and the executive director of Women Against Alzheimer's. Brooks is charged with directing its growth strategy through strategic partnerships and marketing initiatives. Brooks is a nationally recognized subject matter expert in caregiving and is often called upon to speak with groups on topics such as cause marketing and strategic partnerships. Brooks has served in leadership capacities for various nonprofit governing organizations and committees. She's authored white papers and articles and training documents for nonprofit leaders. Brooks also has personal caregiving experience as she cared for her late mother-in-law who lost her battle with Alzheimer's disease. So lots of great experience that Brooks brings to this conversation. Again, welcome, Brooks. Thanks for being here.
Oh, thank you so much for having me. And thank you to Home Instead. I mean, I tune into these monthly chats and I really applaud your efforts in educating people and creating these opportunities for conversation. So thanks so much.
Oh, well, thank you so much for that. It's a true honor to be able to bring together experts like yourself into these chats and talk about very pertinent topics. And brain health is certainly one of those. And we know that Alzheimer's disease, a form of dementia, Alzheimer's is really a complex journey. And I know your organization, Us Against Alzheimer's, is really focused on early detection. So can you tell us more about that?
Sure, absolutely. Well, Us Against Alzheimer's, we are a patient advocacy organization. We've been around for about 10 years, celebrating our 10-year anniversary. And among the many policies that we advocate for, one is around early detection and diagnosis. It is startling to me, and I'm sure to those tuning in, that about 60% of cases of Alzheimer's disease go unrecognized in people 65 plus. 60%. And when people are diagnosed with Alzheimer's, they're often diagnosed late, right? Like perhaps if we were talking about cancer, if we were diagnosing colon cancer, breast cancer in stages 3 and 4, the patient advocacy community would be up in arms, right? And yet with Alzheimer's disease, we don't really have a proper narrative yet. We're building it on why early detection and diagnosis is so important. Oftentimes when people do finally get diagnosed, they're diagnosed late. It's often in a crisis or a chaotic situation. Perhaps a loved one wanders or gets lost or has a fall. And so we want families to be empowered to have these conversations earlier so that an early diagnosis can happen. And that really does a lot for a family. It allows them to plan their finances, their healthcare decisions, their home care decisions. It allows them to get their medications in order, supports that might be needed throughout the journey. Alzheimer's, as you said so well, is very complex. If you've met one family dealing with it, you've met one family. Mm-hmm. And the journey is not that well understood either. So the earlier we can get people into intervention and support, the more quality of life that family can have. And I think the better off just for our communities and our healthcare system. I know that you mentioned my mother-in-law, and she was diagnosed about 3 weeks into my role here at Us Against Alzheimer's, which, if that wasn't reinforcement that this is where I'm supposed to be, I don't know what is. But I'll never forget sitting around the office with myself, my husband, my father-in-law, my sister-in-law, and my mother-in-law. And the neurologist said, she has a little dementia. And then they handed us a piece of paper that had the A word. And from there, we were really left on our own to try to navigate the next steps. We had to figure out a lot of important questions: how to keep her safe, what should we do about driving, how should we manage medications, how do we allow her to have independence and quality of life, but not have her be in a difficult situation or be in an unsafe situation. So, I'm in this field, and we were really navigating, feeling very lost in the early stages. And so again, that was a very long answer, but early detection and diagnosis helps the family reduce the chaos, and also allows for treatment and allows for lifestyle changes, allows for things that can really make a difference in someone's life. So we're huge advocates for that. And much of our work is aimed at getting people into their provider earlier so that these changes can be recognized and people can get the help that they need.
Yeah, I think that 60% statistic that you shared is very startling. 60% of those that are living with some form of dementia, Alzheimer's disease, they're not getting that diagnosis. And to your point, Brooks, some people might say, okay, well, what's the point of getting a diagnosis? There's really nothing that can be done. And I would argue there's a lot that can be done in terms of planning and getting the support that you need and the resources, even getting into clinical trials to get some of that kind of cutting edge exposure to possible new treatments. There's so much that can be done. And so I think that the work that you all do at Us Against Alzheimer's is so important in educating the communities and educating medical providers. Because as you said, you got that diagnosis, you were handed one sheet of paper and said, all right, go figure it out. And so I think some other great advocacy work that I know that is happening is around educating physicians and medical providers on, how to diagnose and then what to do once you do diagnose. Because I can only imagine as a medical provider, it would be hard for me to give that diagnosis because I might feel like there's nothing that can be done for that family. So again, I think the more education we can provide to all those stakeholders, the better everyone will be.
I think that's absolutely right. And, we have to extend the way we think about providers, right? It's not just neurologists, it's the providers that we and our loved ones are seeing more regularly. It's our primary care physician, it's our OBGYN, it's our ophthalmologist, those that we see more often on an annual basis. If we're starting to notice changes in our memory, it's good to raise this topic. We know that providers are hesitant to talk about it, but mostly it's because they don't have the training or education unless they're in neurology, right? Or gerontology. And so arming providers and arming the provider community with information about risk reduction. We've just released risk reduction guidelines for providers as it relates to cognition to help them understand there are things that you can say, there are things you can address, like diet, exercise, sleep, hypertension, stress, all of these things impact your brain. And so it's not just handing someone a piece of paper. There are a lot of lifestyle things that we can talk about to help a patient on their path. And so we're hoping that that conversation can be expanded beyond just neurology, because we know that there are not enough neurologists in our country to serve all of us. And so those conversations are going to start earlier, and we need everyone in the healthcare system to be up to speed on the latest information.
Yeah, I think that, again, educating those general practitioners is so important, because those are often the first people that that these concerns are brought to the attention of, is that general practitioner, that physician you're used to seeing. And so, Brooks, I think it might be helpful for the audience to talk through some of those changes in memory that might be important to bring to the attention of your healthcare provider, that families might want to keep an eye out for, just in terms of their loved one's cognition.
Sure. I mean, listen, when we think about Alzheimer's disease, it's a neurodegenerative disease, right? It impacts our memory, our behavior, our thinking. But we know that age is the number one risk factor for Alzheimer's disease. But cognitive decline is not necessarily a normal part of aging, right? So it's kind of, you're getting both of these messages, which I think can be really confusing. And so what I want to obviously emphasize, I am not a doctor, but I am an advocate in doing this work. And what we often tell folks is that just like your heart changes as you get older, your skin changes as you get older, so does your brain. And the key is to be aware of your brain and what your brain is normally doing, so that if you notice subtle changes, you can raise them. It could be a sign of cognitive decline. It could be a sign of a vitamin deficiency or something else going on inside of your brain. But things that you normally do. So if you are someone that on a regular basis misplaces your keys, if you're doing that in your 30s and 40s and you continue to do that in your 50s and 60s, that's probably just part of who you are. And that's not necessarily something to be concerned about. But memory loss that starts to disrupt your daily life, right? Forgetting events, repeating yourself, replying over and over again, things that might disrupt kind of what is normal for you is something to certainly be thinking about. Challenges in solving problems that you once were able to solve. That's something you want to take a look at. Difficulty completing familiar tasks at home, right? Those are some of those things that it could be normal aging, but if it's really a departure from what is normal for you, it's something that you want to raise. Certainly confusion with time and place is definitely something that if you're noticing, and you likely are, we are aware of those things. And that's the other thing I think, Lakelyn, that folks don't always realize is that you might notice these changes in yourself before someone notices them in you. And so that's why we feel so like it's so important to put these signs out there. Let's talk about them more, so that these are the earliest signs, and you can get help early so that your quality of life can be much better than if you were to kind of ignore it or explain it away, which a lot of people do, understandably. There is a lot of stigma. This is not an easy topic. It is not easy to talk about a change in your memory. And it's something that we really need to work on in our country to normalize these conversations so that we can be having them more regularly.
Yeah, I think that you're right. Normalizing them, making those kind of signs and symptoms known, because so often I talk with families who are farther along in the Alzheimer's journey, and they reflect back and they say, yeah, I actually, if I am being honest, I saw those signs and I just brushed them off. I ignored them, and I wish I would have acted upon them sooner. And so if we can learn anything from those that have gone before us, it's, don't ignore those signs, don't ignore those symptoms. And like you said, if you have any cause for concern, bring them up with your medical provider. And I think one of the things recently that has been made available to those of Medicare eligibility is a cognitive screening as part of your Medicare annual wellness exam. And so even just if you have, you're not noticing changes, it might be good to just get that as a baseline. And then you can use that to measure yourself against if, you are starting to feel like, okay, I'm noticing some changes in my cognition, and you can be reevaluated, and there's that comparison. So any of those concerns, bringing them forth to the medical provider will be beneficial in the long run to that whole journey. Because like you said, it could be something not related to cognition, and we want to be able to certainly rule those things out. And best case scenario, there's no noticeable issue, and you can start to engage in those risk reduction factors, which I know we're going to talk about in a little bit, but you can start to do things that are good for your brain to kind of maintain your cognition and reduce your risk of any cognitive impairment.
Absolutely. And I would encourage people to think about other screenings that they get regularly, right? I mean, I was just talking to a family member who is in her 50s, and she gets she's a little over 50. So she's had a colonoscopy twice, right? She's taken a depression screening when she goes for the doctor. I said, your brain is no different. Let's put the brain at the top of the list in terms of these conversations. None of us are afraid to ask for a mammogram, as women when we are over a certain age. So I would just encourage us to really think about our brains as vital organs, as you said so well, and I'm stealing it. It is the command center. It's responsible for everything, yet we leave it out of the conversation. And so I just encourage folks to really think about other places where they may get, other screenings that may take place. It's no different than that. And it's okay to ask, and it's okay to push back. It's okay to say, no, I think this is something more than just hormones or more than just, I'm really busy and stressed. I'd really like to do that baseline. It's okay to push and ask for that.
Yeah, that's a great point. Well, and I think one of the great tools that your organization has helped to develop is BrainGuide. For those people who are thinking to themselves, okay, is this something to be concerned about? Is it not? This is a great tool and resource for the general public. So can you tell us more about BrainGuide? I think it's just a great tool.
Sure, absolutely. So we created BrainGuide at Us Against Alzheimer's. We launched at the end of March. And essentially, it is a platform that includes memory questionnaires. And these memory questionnaires can be taken for yourself if you're worried about your own memory, or they can be taken on behalf of a loved one that you see often. And both of the memory questionnaires are based on validated assessments that are done in the clinical setting today, and we've adapted them. So we've made them available via a web bot. So if you go to mybrainguide.org, you can click Start Questionnaire, or via a voice bot. So you can call 855-BRAIN-411 and actually go through the process via voice. At the end of the questionnaire, we ask you a bunch of questions and we go through, I think you've done it as well.
Yes.
We go through a memory screen, and then we provide you with a summary of your answers and tailored resources. And honestly, Lakelyn, this is the place where I think really it differentiates BrainGuide, is that we don't want people overwhelmed. If you're worrying about your memory already, chances are you're overwhelmed, right? Most people in this demographic are juggling a lot of things in their lives. And so we want to make this easy. And we decided that we would tailor our content based on an algorithm, based on your answers, so that depending upon how you do, we point you to the right resources. So we might point you to brain health tips. We might help you understand what is next when you go to the doctor's office. What is screening, detection, and diagnosis in Alzheimer's? How might I raise this topic with my mom? I'm worried about her. What can I do if I need to find local resources? So we tailor and kind of cherry pick these resources that are very, very specific and relevant to how you answer the questions in the questionnaire. You can print it, you can email it to yourself, you can text it to yourself, and most importantly, you can bring it to your doctor. So we did so much market research for many, many, many months with individuals as well as medical experts. And what medical experts told us is, if a patient comes to me with a piece of paper and says, hey, I did this memory questionnaire, I didn't do so well, I want to talk about my memory, that is going to get much more attention than if someone walks in with pages and pages and pages that they printed off the internet. right?
Mhm.
So we're trying to make the experience simple, and we're trying to empower people to bring that information to their provider. We want people to use this as a way to spark the conversation. And we really want this to be accessible to all communities. We built it 100% in English and in Spanish. It is free, it's private. We don't keep the records with your name and email address with your results of the questionnaire. It's really designed to be a public service to get people in the right path wherever they are in their brain health journey.
Such a great tool. And again, the website and the phone number, we're going to put that in the chat so that everyone can check out this resource, mybrainguide.org, and then the phone number is there too. And I think that you have done such a great job of making this, pardon me, user-friendly and making it something that is not intimidating. It's just a few questions. I went through it. It was easy to do. I went through it for myself, and then I went through it for a loved one. And the resources that were also given were excellent. And so I think that this is, again, such a great resource for the community. And I would love to know, how is it going? What has the response been from the public?
So thank you for asking that question. We have been so overjoyed with the response. We've had close to 120,000 memory questionnaires completed in about 4.5 months. And 80% of folks that are coming to mybrainguide.org are actually taking the questionnaire for themselves, which I really thought was exciting and interesting, because we know there are millions of caregivers out there. We know there are many, many adult children worrying about their family members, and we're certainly getting caregivers and adult children taking it as well. But we also know that millions are worrying about their own brain health. Mm-hmm. And so the fact that they are using this resource for themselves is really gratifying. And our goal is to certainly increase that exponentially. Our vision is to reach millions of people. We don't want anyone left behind. We took a lot of care in creating this for all communities. We did market research in the Latino community, with Black Americans, in rural settings, in urban settings. We really want this to be utilized as much as possible. Again, we're not solving everything here. We're not making a diagnosis for sure, but we know that the single biggest point here is that people aren't having the conversation. They're not starting the conversation. If we can give people that nudge to start the conversation, empower them with a piece of paper that explains what they did, and they can bring that to a healthcare provider, we hope that gets them on the path. And that's really what we're really focused on. So it's exciting to see. And actually, 76% of people that have participated so far have told us they feel more confident raising the topic with their provider, which is huge, right? I mean, that's what we want. We want people to feel confident to say, hey, something doesn't feel quite right. And I did this memory questionnaire, and I think it's time we have a longer conversation. If more of those conversations happen, more people will get the help they need much sooner. And that's only a good thing.
Absolutely. Well, we have someone asking, is BrainGuide only for assessing Alzheimer's disease, or can other forms of cognitive impairment like MCI also be detected?
Yeah, so that's a great question. I mean, the cognitive assessments that we built BrainGuide from are actually used in the clinical setting today to detect mild cognitive impairment and Alzheimer's disease. They are not they're not validated for use on the WebBot, meaning there haven't been, decades of studies on them, but we've adapted them for the WebBot. And so, yes, the earlier MCI, it's not as sensitive as if you're sitting with a doctor and going through the screening, and it doesn't diagnose. Just like if you were in the doctor's office, a screening does not diagnose either. It just highlights a potential problem that then further diagnostics are necessary.
Thank you for that information. And can you talk a little bit more about the resources that you provide on the site? Because there are so many. I started to go through them, and I was like, wow, this is really robust. There's so many different topics that you cover from a resource perspective.
Well, thank you. I mean, coming from you, I'll take it. We'll take the compliment. So what we did is we kind of mapped out the journey, right? So we started thinking about someone, I'll use the phrase, the worried well, someone who maybe they're in their, late 40s, early 50s. They're generally healthy, but they're starting to worry. Maybe they have a family history. Maybe they just are seeing it more in the news, whatever the case may be. We developed resources for that person all the way through to I'm living with Alzheimer's disease or I'm caring for a loved one with Alzheimer's disease. So you can find resources on the pillars of brain health, how to keep your brain healthy. You can find resources on screening, detection, and diagnosis. So if you were to ask the average person, how do you diagnose cancer? Most people would have a sense, right? They would, maybe there's a screening and maybe then there's a biopsy. Most people would know kind of the steps, even though it's different, obviously, for different types of cancers. Most people wouldn't know all the steps to screening, detection, and diagnosis in Alzheimer's disease. So we explain that. We talk about the treatments that are on the horizon. We talk about the value of local resources. Lakelyn, you and I over the years have talked about this a lot. Care is local, right? Home care, community services, things that you need when you are managing caregiving for someone with cognitive decline, regardless of the type. There are things that need to be done to keep your loved ones safe. There are things that need to be done to manage their healthcare, their medication management. So we touch on ways to get those resources. We talk about clinical trials, as you said so well. In many other diseases, clinical trials are seen as state of the art, treatment, and let's see what is available. Where are the innovations? Well, we want more people to be aware of clinical trials in brain health, in prevention, right? There are prevention trials out there, and there are also clinical trials in Alzheimer's disease. So we really try to cover the gamut. And then, of course, caregiver resources. I know we link to a few that Home Instead offers, and we know that caregiving for anyone is challenging, but certainly in the space of Alzheimer's, there are unique challenges, and the caregiving journey is a long one. And so we're trying to, ensure that BrainGuide offers tips and ideas, or at least links to other resources that people can get the support that they need, because we know that it's a big challenge. And so we're really continuing to build our resources. So for anyone listening, if you see something missing, don't hesitate to comment and let us know, because we want to continue to make it valuable for everyone that we're serving.
Thank you so much for an overview on those resources. And I think we have a comment that I just want to kind of tie into this conversation, because we have Barbara who's asking, how do you distinguish caregiver stress, lack of sleep, along with being overwhelmed mentally and emotionally? How does that impact memory? Barbara is 58. She's a full-time caregiver for her mom, her 93-year-old mom with dementia. She says she rarely gets a break. She's on around the clock, at least 18 hours a day, trying to run a family business from her home. She says it's very overwhelming. And I think, Barbara, one, you're not alone. This is a very common situation. And we thank you for all you're doing for your mom. I'm sure your mom is so grateful for your care and support, but caregivers often put their own health and wellness on the back burner. They are experiencing elevated amounts of stress. Maybe they're not quite eating right, or eating nutritious meals. They're not getting exercise, again, because they just don't quite have the time. And I know some of the resources on BrainGuide's website centers around kind of that preventative risk reduction, those pillars of brain health. So that might be some information you could offer up to Barbara, so that she can continue to take care of herself as she cares for her mom.
Sure, absolutely. Well, Barbara, my heart goes out to you, and I share Lakelyn's sentiment that you are not alone, but I know so often it feels like you are. Even in my own experience, it was very isolating, and there are moments where your own health is certainly compromised. And I would say, above all else, give yourself some grace, right? Because it is not an easy task. And you don't have to do everything on the checklist. In the early days of caregiver education, I always thought it was, a little bit interesting or maybe funny or not so funny when, someone would give a caregiver a checklist of things to do. And the reality is it's really hard to get everything to do for yourself, along with taking care of a loved one and managing your life. There are things that can be done for oneself when you think about lifestyle, like part of your day-to-day routine. So as hard as it is, thinking about exercise, thinking about even walking in place if you can't leave your house or home and you need to keep your body moving, even standing when you're at your desk doing your work, thinking about ways to keep your body moving. I'm not going to sit here and tell you, Barbara, to start meditating or begin meditation practice, because that would just be ridiculous. None of us have time to meditate. But I have found personally, and again, I'm not a provider, but I have found personally I have my timer set on my phone a few times throughout the day where it goes off and I just stop and take 10 deep breaths. Really just calming our system and our mind can really make a huge difference, and breath is huge in that. So even doing small things like that, thinking about your nutrition, working as hard as you can to ensure, you limit your processed foods, staying really hydrated, getting enough sleep, all those things are really good for your brain, and they can help reduce stress. The other thing I would offer is, and I know this is really hard for caregivers, but thinking about ways to ask for help. My guess is that you've got friends and family around you who, if they knew how stressed you were, would want to help you. And what they might often say is, Barbara, what can I do to help? And you're so overwhelmed that you might not even know what to say to Sally. But if you think about, one piece of help you could get every week, maybe you say, you know what, Tuesdays are a really long day for me. It would be amazing if you could bring me dinner on Tuesday night. And, I know you're going to be in a caregiver someday and I'll return the favor. People want to help each other. And we learn this so much too from the pandemic. We want to support one another. So I would encourage you to think about ways to tap into those offers of help and be really specific and just get yourself a little bit of a break a few days a week. It really might go a long way and be very comforting to you. So I hope that you kind of can lean into your community a bit.
Those are really great suggestions, Brooks. And Barbara, I think, again, I love that Brooks said, give yourself a little bit of grace, because you are taking on a lot. And sometimes when we're stressed, we are a little more forgetful, or when we're really distracted, we might forget where we place something. And so it doesn't necessarily mean you are experiencing cognitive impairment, but it's something, again, to bring up with your healthcare provider. You do have a history of it in your family, and that is one of the risk factors of dementia, but it doesn't guarantee that you're going to get it. So I think, Barbara, being on this webinar is a great step for you in learning about the resources that are available. I love Brooks' example of being specific when asking for help, and even looking into respite care, just to have someone come into the home. We provide that at home instead, but it could be a family member just coming over to relieve you for a few hours. You can go for that walk around the block, or you can hit the grocery store to find some nutritious foods to fuel your body. So some great tips there. And Brooks, I know for those that maybe have a little more time on their hands, there's a great brain health challenge that Us Against Alzheimer's introduced a few years back, but that resource is also linked on my BrainGuide. Can you tell us a little bit more about that brain health challenge?
Sure, absolutely. Well, we did market research a handful of years ago, and what we learned was that people were really intrigued by the concept of brain health, but they weren't really sure what steps they needed to take to care for their brain. It wasn't well understood. And so we took a page out of, the Cleveland Clinic and many other groups that talk a lot, like Home Instead, that talk a lot about brain health and what those pillars are. And we created a 30-day brain health challenge. And you can visit my BrainGuide.org and you can click on the challenge and sign up. And every day for 30 days, we give you one tip. This might be related to healthy food choices, or getting enough sleep, or moving your body, or being aware of risks like hypertension or diabetes, getting yourself in a, socially active with your peers, which has been really hard in this pandemic, but now we're coming out of it. And certainly I think we've found ways to connect over the phone and Zoom, reducing stress. Again, not maybe adopting a meditation practice, but starting to just take small breaks throughout the day. So things that we know are good for our hearts that are also good for our brains. And if we just give this daily reminder so that people can start thinking about their brains, so their brains are top of mind, so to speak. And we know that these small changes over time can really make a big impact. I mean, more and more we're realizing that Alzheimer's disease is something that we can hopefully prevent, and certainly we can reduce our risk if we put these steps in place. And they're not easy. And listen, all of these lifestyle behaviors, they're not accessible to all communities. And that's something that Us Against Alzheimer's is very aware of, and we're working hard every day to ensure that there's equity across communities so that people can have brain health equity. We actually coined that phrase, and it's because we want all communities to have access not only to this information, but to the resources they need in order to keep their brains healthy.
Thank you so much for sharing more about that challenge. And one last question I have for you before we open it up for questions from our listeners, because there's so many great questions coming in. Thank you for submitting questions. Please keep them coming. We're going to try to get to as many of them as we can. But Brooks, what gives you hope about all of this? I know sometimes, again, there's the stigma attached to dementia still in our society. Alzheimer's disease can seem negative at times, and I always like to cling to the hope that we have before us in this disease. So what gives you hope?
Such a great question. And I know for many folks listening, who are in the throes of caregiving, these glimmers of hope may not, you might not feel them every day. So I'm hopeful that you listening to this, gives you some hope too. I mean, there's a lot to be hopeful about. We have new treatments on the horizon for Alzheimer's disease. There are over 260 studies going on right now around Alzheimer's prevention. Us Against Alzheimer's is leading an effort with the administration, encouraging the administration to adopt a national prevention goal for Alzheimer's disease, which we are very hopeful that resources and changes in policy will soon follow. We also are creating a new narrative. I mean, this disease is one that is often not talked about, or if it is, it's talked about in quiet circles, or, oh, my mom had that, I can help my friend, right? Or some, small conversations that are happening. Mm-hmm. And we're actually starting to see this cause take hold in mainstream media. So when we look out in the entertainment industry and we have movies like Still Alice and The Father, and now Supernova, and Here and Now with Billy Crystal, we have people like Lisa Genova who have amazing platforms and are putting information out there for the masses to see. We are talking about this disease in new ways, and I think that is really going to help all of us as a society address it earlier. And the more of us that are making these opportunities available, I mean, just the fact that Home Instead, you all are like on the forefront, always putting information out there and breaking through that stigma, the more we can communicate and talk and share our stories, the more we can problem solve and hopefully get people the support that they need. So I am inspired by the science for sure, in terms of prevention and treatment. And I'm inspired that, the entertainment industry, not just movies and television, but books and podcasts and everything else, we're talking about this issue more and more. We're normalizing the conversation. So anyone that's worrying, hopefully has a safe place that they can raise the topic and get the help that they need.
thank you for sharing your thoughts on how you're hopeful for the future. And I agree. I've seen Alzheimer's disease depicted more in popular media and popular culture. And one of the partnerships we have, and I know you're close to this organization as well, Hilarity for Charity, HFC, they do a great job of bringing some humor to this subject as well. And so we're seeing some great education coming from Seth Rogen and his wife, Lauren Miller Rogen. So you're really seeing some influential people coming behind this disease and sharing their personal stories. And that's, I think, what it takes to destigmatize this, is people just normalizing the conversations around the disease and around brain health.
I agree. I love HFC. We collaborate with them as well, and we're so happy to do so, because we know collectively we're gonna make an impact. And we all these groups that are doing great work, we all kind of tackle it a little bit from slightly different perspectives, but I think that's what's going to ultimately raise all boats, and I'd be remiss if I didn't mention Mandy Moore, who is our spokesperson in brain health for Us Against Alzheimer's, and ambassador to our campaign. And, for those that might be familiar, she stars in This Is Us and plays a character, Rebecca, who was diagnosed with Alzheimer's. And, imagine just the millions of American households that are watching that storyline. And I would love to imagine many, many conversations starting because of that storyline, right? And so I think that the more we can put these pieces of art and entertainment, in our households, the better for everyone, for sure.
Absolutely. Yes, there are so many organizations working together, and it is neat to see people tackling it from all angles. And, we just at Home Instead value our partnership with Us Against Alzheimer's, and it is a close-knit group of organizations that really do champion one another's efforts. And I think in the years to come, we'll see even more movement in this space, which excites me.
I agree completely. Yep.
Wonderful. Well, this has been such a great conversation. We have some really intriguing questions coming in. So
okay.
I'm going to kind of jump into a few of them. I know we've touched on a few of people's questions and comments. And I know when Barbara shared her story, we already talked about that a little bit, but several other people said, that's my caregiving story too. Barbara, thank you so much for sharing. So even on this call, Barbara, you're not alone. There's other caregivers out there. So anyone that hasn't sought out resources or supports, there's so much great support out there. Another individual has kind of shared their story. This individual is taking care of their mom, has been doing that for the past 4 years, and has painfully witnessed her decline. And this person does not want their kids to ever go through this if they were to get dementia down the road. And he or she is asking, is this common? Is this a common concern of caregivers? And I would say yes. I'm sure, Brooks, you've heard this too, that people are watching their loved ones go through it. They don't want to go through it themselves, and they don't want to put that onto their children. So I think, Brooks, would you agree that that's just this individual, that early detection and diagnosis, that will be very important for their family to just stay on top of it in case they also down the road have cognitive decline. But I think the other bright spot is there's a lot that this person can do now to reduce the risk.
Absolutely. I mean, I think it all comes, none of us want to be burdens to our family, right? And I shouldn't even use the word burden, because I know for so many, and me included, I never saw caregiving as a burden. But when we think about planning for the future, there's a lot of categories of planning, right? And so the best way to prepare the family is to start these conversations, certainly about health, but also about finances, also about healthcare decisions at end of life. A lot of families we talk to struggle with, now my mom has reached a place with her cognition that I think I need to rethink about her care, whether that's bringing someone in, whether that's moving her out, whether that's changing her home. And wouldn't it be amazing if we could have those conversations earlier with loved ones? So that would be my advice, is to, if you have been a caregiver to an aging parent or someone dealing with Alzheimer's and you're thinking already about your own kids, start those conversations sooner so that there's no question marks. I mean, I think as adult children, we often struggle with, am I doing what my parent would want me to do? And so the sooner we can start those conversations, the better. I also would caution and remind us that we don't have to have the whole conversation. Do you know what I mean? Like, we don't have to sit down at Thanksgiving dinner and talk about, finances and healthcare and medication and all of it. But we can say, you know what? We're all getting a little bit older. Let's figure out a way to start having these conversations. There are lots of resources out there that kind of walk you through some of those, steps. And I would just encourage families that are starting to worry to just begin. And it doesn't have to be the whole thing. You don't have to get it all done in a week, but that's the beauty of the gift of time, if you get ahead of it before you're doing it in a crisis. So that would be my biggest advice related to planning, is just to engage in those conversations as soon as you can. And that way your family can be relaxed about it, and everyone's voices can be heard, and everyone can feel good about the plan moving forward. Or maybe if they're not feeling great about it, at least they know what it is, and they can organize themselves accordingly.
I think that's such great advice. It's never too early to start those conversations.
Right.
I know at Homestead, we have this action plan for successful aging that really talks through not necessarily just the cognitive and the health, but all those other aspects that you mentioned: finances, where you'll want to live. Do you have your advanced directives in place, your healthcare powers of attorney, your financial powers of attorney? There is a lot that can be done before a crisis that can really help families during that crisis, because you've already had the conversations, you've already appointed the individuals to make decisions on your behalf, those types of things. So I agree. Starting these conversations around planning early will hopefully be helpful in the long run. So we hope that is helpful to our audience today in terms of tips for some good next steps. Another question we have from, I believe it's Kiko, and I apologize if I pronounced that wrong, but this individual is caring, or they have loved ones long distance in Japan, and this person's dad is caring for the mom who is living with dementia. And, being a long distance caregiver can be so challenging. I've watched my own sister and her husband care for parents long distance from New York to Scotland, and I've just watched them go through that. And so Kiko was asking, until they reopen and I can go visit, what are some things that I can do for my dad who's caring for my mom? I feel like all I can do is really listen on the phone. And of course, I think that is probably very supportive to your dad, just having that social support. But I know that as long distance caregivers, you might want to look into other ways that you can support from a distance. Maybe it's ordering their supplies for them to be delivered to the house, or perhaps putting together a little care package of things that your mom really enjoys. If you think back over her lifetime, if there are any activities that she always enjoys, could you put together a little care package and send it over so that maybe it can introduce some new and exciting activities into your loved one's day. But that is a really challenging situation. And Brooks, I know you have personal caregiving experience, but any other words of advice for Kiko on their family situation?
Sure. I mean, I would say thinking about things that can be done from a distance now, given the fact that we obviously live in a digital age. So if there's research that could be done that perhaps your dad isn't able to do easily. So whether that's around treatment or clinical trials or local resources, if there's documentation that could be done, documenting the doctors and providers and medications that your mom is taking. So everybody has a shared file of all of that information. I'm not sure if you all are talking on the phone or if you are talking via Zoom. This is just a personal story, but when my mother-in-law, who was in a different state, she oftentimes had trouble talking on the phone with us because she wasn't always recognizing voices and they weren't using technologies like Zoom. So we actually created a poster with a photograph of each of her children and their families with their names in block letters, and that was printed and taped next to the phone. So whenever, because she used a landline, so whenever we did call her, she was looking at that poster. So if I said my name and she saw my photograph, and my father-in-law would point to me and my name. So it gave her comfort that she could participate. I don't know what stage your family is in, but for anyone listening, things like that, just to simplify even the phone engagement, can bring a lot of joy, I think, to the person living with the disease as well as caregivers. So that's another option. I also think, scheduling a routine, if there's one time a day, every day that you're able to talk with your family, or one time a week, just to have that consistent. It's great for your dad because he might know that that's a little bit of downtime for him, and also great to create that consistent schedule with your mom as well. So those are just a few of my ideas off the top.
Oh, I love those suggestions, Brooks. I hope that is helpful, Kiko, and our hearts go out to you, because long distance caregiving is really tough, and we're living in this crazy world where it makes travel more complicated, and getting to see our loved ones is often more complex than it once was. And so you do have support here in this community of this live chat, and please don't hesitate to reach out for supports. And I know that, HFC, they do have online support groups. I know the Alzheimer's associations locally across the country have support groups too. So it could be good to join one of those to be able to share your experiences, because I'm seeing a lot of commenting and supporting of one another, even in today's chat amongst participants, which I love to see. And I think Phoebe, she brings up a great point that, caregiving is challenging, and there's sometimes stigma for caregivers who feel the burden of caregiving, and who maybe really didn't have a choice in taking on that caregiving role, or who really don't enjoy it, or don't find it as fulfilling as other caregivers. And I think, as caregivers, it's a range of emotions that people experience, and it really is important to acknowledge your feelings, and everyone's experience and everyone's journey is different. Brooks, you mentioned that earlier. If you've met one family, you've really just seen their one situation. And so, Phoebe, we recognize that it's not easy, and the feelings that you have around caregiving are valid. And so, I don't know, Brooks, if you have any other thoughts around that. I'm sure as a caregiver, you went through a range of emotions as well.
Yes, no, absolutely. And I wish I could retract the word burden, because it's such a loaded word, and I didn't mean to imply, any kind of opinion around that. I think everyone's experience is their own. And frankly, every hour is your own, right? There are moments of joy and kind of accomplishment when you get through a task. And then there are moments of dread and isolation. And I do think it is a roller coaster, and the opportunity to talk about what you're experiencing and feeling, and the opportunity to get support from support groups, from events like this, I hope really reduces that for the community of caregivers. I mean, there's millions of us out there, and we're all doing the very best that we can. So we really need to have grace with ourselves and with each other.
Thank you for sharing. So I know that we probably have time for just one more question. And we had someone on the chat asking, when you were creating My Brain Guide, what kinds of tools? You mentioned, you use those tools that they use in a clinical setting, and kind of adjusted those for My Brain Guide. So is there a spot on the website where people can learn more, or are you able to share a little more about that, Brooks?
Sure. There is information about the evaluation tools on the website in the About section. And, I will tell you the caregiver questionnaire is based on the AD8, Alzheimer's disease 8. And that's out of Washington University Medical Center. And we have the permission, we've licensed that and adapted it for the voice and the WebBot. And then the questionnaire that you can take for yourself, if you're worried about your own memory, is the MIST, memory impairment screen. And the T stands for telephone because it is validated for phone use. And that is a word test. So we ask you a few questions up front, and then we go through a 4-word memory test where we share 4 words with you. We share the categories. So if we say, flamingo, it's a type of animal. And then we do a series of distraction tasks and then ask you to share those words back. And if you're not able to remember the words, or if you're able to remember them but need clues, if you need support from the system with clues, that generates a different result than if you were to remember all of 4 words without any prompts or without any support. And so those are there are many tools, unfortunately, that get used today, but the MIS and the AD8 are very commonly used in the clinical setting. So we've adapted them, made them familiar to folks. And that way, when you do take the summary into the provider, it will be largely familiar to most providers, or understand what these tests are.
Fantastic. Thank you so much for sharing, Brooks. And I know there was a couple questions that came in at the last minute around eating. I wanted to just share, Home Instead has a great website, helpforalzheimersfamilies.com. And we have a tips section that's categorical. So you can click on kind of mealtime and eating. And if you go to, again, helpforalzheimersfamilies.com, you can find some great tips around eating in mealtime. So Brooks, thank you so much for joining me today. We had so many great questions. Thanks everyone for joining. This has been such an interactive group. I really thoroughly enjoyed the conversation. And thanks to Us Against Alzheimer's for creating BrainGuide and for really spreading helpful resources and information around brain health. It's so vital for all of us. As we've been talking about, our brain is the command center for our whole body, and it's really an important organ that we should all be paying attention to.
Absolutely. Well, thank you so much for having me, and thanks to the amazing participants today. It was a really exciting and engaging discussion. So thanks for having me.
Well, the pleasure was all ours. And this is part of a larger series of caregiver chats. We do this every month. So next month, I hope you will join us on Wednesday, September 15th. September 15th, we will be talking about dementia home care with Ian Kramer of Lead Coalition and Bonnie Waddles from HFC, Polarity for Charity. We've been talking about that today throughout our chat. So both of them will join me as we talk more about dementia home care and having that support in the home. And September, in the month of September, there's also World Alzheimer's Day. And so I hope that you will follow us on our Facebook page because we will have some great resources coming out. I just recorded a series of tips videos for Alzheimer's disease. And so I hope that you'll tune in and take advantage of those great tips videos. And I hope you'll join us back here on September 15th for our next caregiver chat. But until then, take good care of yourself while you're caring for your loved ones, and we'll see you soon. Bye.